Hi, Gerald Johnson here. Going to be going over the axial skeleton. I'll put the skeleton up close to help out with some of the contrast so you won't be seeing my face the whole time. But we'll start right off. The front part will be the frontal bone. The two sides here on the top are your parietal bones, and then the back here is your occipital bone. There is the external occipital protuberance, and that connects to a few ligaments to help keep your head stable. If you go on the side here, you do have your temporal bone. The temporal bone has a few parts, including the mastoid, just a little part hanging down there. You also have your styloid process, which is hidden on this little guy, but it is right about there. Right there. You also have your external acoustic meatus. Where are you, Mr.? There you go, right there. And then you have your squamous part, which will be the flat part of the temporal. If you pop his head open, you can get a look at the internal features of the temporal bone. A few of the internal pieces we have are the petrous part. And then you also have your internal acoustic meatus. That part allows for cranial nerves number 7 and number 8 to pass through. The spinfoid bone actually sits at the back of the orbital socket, and this guy only has one hole, but normally there's a few different fissures, but the main fissure is your superior orbital fissure, and that allows for cranial nerves number 3, 4, and 6 to pass through. If you look at the inside, or the internal part of the spinfoid bone, it is kind of shaped like a butterfly or a moth, depending on who you talk to, but you do have the lesser wings and the greater wings. You also have the optic canal, which are the little holes right about there, and those allow for the optic nerves to pass to, or cranial nerve number 2. You also have the sella turnosa, and that holds your pituitary gland. The ethmoid bone is the little bone that sits right up top here. Super small. The main parts are the cristia gallia, and that connects to your dura mater, or your meninges, to hold the brain inside of the cranial cavity. And then on the lateral aspects of it, you do have your cribriforms, which are perforated pieces of bone that allow for filaments of the olfactory nerves to pass through. A few of the sutures, or parts that join the skull together, are your coronal, which will separate your frontal from your two parietals. You have your sagittal, which connects the left and right parietal. You have your lambdoid right there, which separates your occipital from your parietals. And then you have your temporal, which this guy actually doesn't have the squamous suture that separates the temporal from the parietal, but it sits about right in there. Next, we'll get into the facial bones. You have your main facial bones, which are your maxilla, and your alveolar processes are what hold your teeth in place, the cavities that your teeth go into. The nasal bone, which is the most superficial actual bone. After that, the rest of your nose is all cartilage. You have your zygomatic process. The zygomatic bone connects with the temporal process of your temporal bone and forms the zygomatic arch. The next few bones are not actually on here, but you do have your vomer, which sits right in the middle and goes kind of up on the nasal cavity. And that and the perpendicular plate of the ethmoid bone are what form your nasal septum. On the lateral aspects of it, kind of right in that area, you normally have your inferior nasal concha. And what those do is they actually cool and warm air before it gets inside of your lungs. You have your mandible, which has the body of your mandible, the mandibular arch, the ramus, the ramus being the part that goes up here, as well as the mandibular notch, which is the little arch right here. You also have your mandibular condyle, and that connects with the temporal bone to form your TMJ joint. And then you have your colonoid process, which is the other arch on the mandible. Next, we can talk about the vertebral column. A few parts of the vertebral column, you do have your cervix, which has your cervical curvature. Over-exaggerating these a little bit, but then you have your thoracic, which has your thoracic curvature. Then you have your lumbar, which has your lumbar curvature. And then your coccyx, which has your coccyx curvature. The cervical vertebrae has 7 vertebrae, the very top one being the atlas, and the one below that being the axis. The atlas actually holds the occipital bone and the skull, and is what the head actually sits on. The dens comes off of the axis, and so the atlas sits on top of the axis, and through the dens it allows you to pivot your head in a rotating motion, which is commonly known as the no. On top of that, also you have your transverse processes, which are on the side. Let's see, right? That might be able to get it. But the special thing about the cervical vertebrae is that each one of these transfers actually has a transverse foramen, which allows for arteries to pass through so that blood can make it to the head. Next, we have your thoracic cavity. If I didn't mention before, you do have 7 cervical vertebrae. After that, you have your thoracic cavity, or the thoracic vertebrae. There are 12 thoracic vertebrae total. You have your spinal processes, which is the main bony part that sits on the most dorsal part of your spine, the part that you can normally feel if you rub your hand down your spine. And then you have your transverse processes, which are the processes that are on the side that connect your ribs to it. You do have your intervertebral disc, which sit in between the bodies, or the centrium of the vertebrae. So your centrium is the main body part, and this would be your intervertebral disc. Inside, there is a foramen, or a hollow canal, inside of each vertebrae. Big hole in there. And that allows for your spinal cord to pass through, and that is known as your intervertebral foramen. Next, you have your lumbar vertebrae, which there are 5 lumbar vertebrae. After that, you have your sacrum, which has 5 fused vertebrae, and then your coccyx, which is 4 fused vertebrae. Next, we'll talk about the sternum here and the thoracic cage. Sternum, manubrium sits at the top. Next is the body, and then the lower part is the xiphoid process. At the very top, there is a little notch here, and that is called your jugular notch. We'll talk about the ribs. There are 12 ribs total. Ribs number 1 through 7 are known as the true ribs, or the vertebral sternum ribs, and that is because they connect to the vertebral column and to the sternum directly through the costal cartilage. Ribs number 8 through 12 are known as your false ribs, or your vertebral chondrial ribs, and that's because they do not directly connect to the sternum. Ribs number 11 and 12 are known as your floating ribs because they do not connect to the sternum at all. A few parts of the ribs, which are kind of hard to point out on this guy, but I'll try my best. You do have your head, which is actually wedge-shaped, and we'll get into why that is in a minute. Then you have your neck, which comes right off of that. So your head, and then your neck, and then next would be your tubercle. Again, kind of hard to point out on this guy, but the head is actually wedge-shaped because it connects, not only the posterior part connects to the same number of thoracic vertebrae, so number 8 rib connects through number 8 thoracic vertebrae at the posterior part of the head, and then the opposite part of that will connect to the superior vertebrae. You also have your tubercle of the rib, which articulates with the costal fossa of the thoracic vertebrae, and that is the next place that is joined to articulate with the vertebral column. I believe that is everything, so bye-bye, till the next one.